In the name of Allah, the most beneficent, the most merciful. In the previous interview, we tried to get this thing highlighted by a Pakistani qualified fellow of Australian College of General Practitioners. And today we will try to continue the same interview, and we will go into depth and ask that brilliant doctor how Pakistani doctors, Pakistani graduates, they can pursue their career in Australia as general practitioners, or they can go in various other specialities being in Australia. And thirdly and lastly, we will ask that particular brilliant doctor what should be the structure of family medicine in Pakistan, and what are his opinions and what are his advices. So we welcome our Pakistani graduate of King Edward Medical College, Dr. Gajur Ghazi. Assalamu alaikum sir, how are you? Welcome back sir, and I would like to continue the same interview, the same thread, and ask you, would you please tell us, the Pakistani graduates, how can they pursue their career in Australia as a general practitioner and another specialized? And then we will proceed to the third very important question. Sir.
Thank you for asking me this question. I think for a Pakistani graduate, you should be done basic medical qualification, and then you have to prepare for Australian Medical Council exams. We know it's got two parts. It's MCQ part and clinical part. So we can appear in overseas or in Australia, or after that you apply for job if there's any availability for jobs after passing your MCQ part. We need very competent language skills with a very high band score in language exam, OET or IELTS exam. That's probably you have to do 7+ band in each, writing, listening, reading, and all the 4 components. So if you're lucky enough to get a job after MCQ part, you can, but otherwise you have to go through the clinical part as well. And then AMC clinical exam is getting a bit difficult these days. You have to prepare well for it. So after both parts, then you apply for attachments for medicine, surgical and emergency medicine attachments in the hospital. And once you complete those attachments, then you apply for a general registration with Medical Board of Australia. This is the time when your career starts in Australia. You apply for permanent residence, and then you start applying for different training pathways. And then once you get general registration, then you have got multiple training pathways. As I said in my last interview, it's a physician pathway, surgical pathway, general practice. Physician training, we know you have to do 3 years of basic training, then there's the exam, and then you do 3 years of advanced training. General practice is the same thing. You apply for Australian general practice training.
Sorry for interfering. Would you please highlight the nature of the structure of the attachments you do in Australia, because it will be an eye-opener for the local graduates also. What sort of attachments you do in Australia, being a resident of general practitioner?
General practice training is basically 3 years training with AGPT, Australian General Practice Training. First year you have to do in hospital, The whole 1 year you spend in the hospital, in which you do emergency, general medicine, general surgical terms as a resident doctor. And after completing 1 year, then you are sent to the general practice, where you complete 3 terms of 6 months each term. That's the second year of your GP training. So the first 6 months and then the second set of 6 months, and then you go for, after completing your term 2, you can go for exams, the fellowship exams, which you complete mostly in your term 3, the third half of the 6 months term. Once you have done the 3 terms of 6 months duration, so it's probably 8 months of GP training after your 1 year of hospital. So then you have to go through 6 months of advanced, we call it extended skills training, EST, which you can do in different things like in indigenous health, in emergency, in community, in sexual health, whatever you like to be. So, and then when you have done that 4th part of your GP training, so that's probably 2 years of GP training after 1 year of hospital. So then you complete your fellowship for the general practice. And then afterwards comes some optional attachments in which, you know, any field you like to excel in, then you get attached to that field.
This is quite elaborative, and I think that the training of a general practitioner in Australia is quite elaborative, quite extensive, and thank you very much, sir, for explaining very handsomely. Would you please tell the Pakistani graduates what should be the structure of general practice training in Pakistan, and do you think, keeping in view the Pakistani health system, the importance of GP training, what should be the structure of training here, and what do you suggest for Pakistani graduates who want to pursue their career in general medicine, in general practice, and what do you think and what do you suggest?
Yeah, that's a good question. I think general practice is a very vital part of any healthcare system in the world. Keeping in view, you can't produce that much number of specialists in every field, like endocrinologist, heart specialist, rheumatologist. It's very hard to provide access of community to all the specialists in a prompt way. And second thing is, it sometimes gets a long waiting time. Sometimes it's very expensive. You know, you have to pay heavy fees to go to specialists, and so I think this gap can be fulfilled by a strong general practice, you know, family medicine department, a strong family medicine specialty in any community. So, as you said, even in Pakistan, there's no structure. I can't see any structured family medicine training program or a structured, you know, department in different medical colleges. So.
Dr. Saab, just because there is a need of the time that we have family physicians, we have consultant in family medicine, working in teaching hospitals and doing the triage and sorting out the patients and helping in training the fresh graduates as residents of family medicine. What do you suggest that if the Pakistani postgraduate colleges, they plan to start this family medicine in every teaching hospital, do you think that we can have the supervisors, because we are lacking the supervisors also? Do you think that the supervisors, we can have the qualified, the well-trained supervisors from abroad, from anywhere? We can have those supervisors for that training, because without good supervisors, we cannot develop a specialty.
Yeah, of course. First thing I would like to say, general practice is not only sorting out the patients. You know, and referring to other specialists. It's an old concept. These days, by the introduction of a fellowship in general practice, I see most of the general practitioners they deal all the complex medical conditions. Even if you take it from cardiology, rheumatology, endocrinology, they've got plenty of experience and knowledge. And if a good GP come across complex medical condition, then they can refer it to specialists. I think you're quite right. It's a time to develop a strong family medicine concept in this community, in which patients, have got very good access to a family physician. Most of the diseases are basically, can be easily 60-70% can be easily treated by a good family physician. Of course, in every medical college, if we develop a good, solid, organized family medicine department, I don't see any reason we won't have very brilliant family physicians in coming 5-10 years, and they can easily fill the gap that we can see in the community these days. Of course, to start with, we need to get some good family physicians from UK, from Australia, from Ireland, and start in every medical school a concept of family medicine, and then grow it gradually. I think it's going to help a lot of this health system.
Dr. Saab, thank you very much. It was a fantastic explanation of my queries, and I wish that we have the foreign qualified family physicians, the consultants of family medicine. Our healthcare system, we try to inculcate, to introduce, to get those consultants as supervisors and train our family physicians, our Pakistani young doctors and graduates, and try to make this healthcare more flourishing and more fruitful and beneficial to the society. Thank you very much for being with us today, and good luck for your future endeavors. Thank you, sir. Assalamu alaikum.